Good afternoon, everyone, and welcome to our session on technology, innovation, and engagement. My name is Lindsay Resnick. I'm the Executive Vice President of Wonderman Health, which is a data-driven marketing, advertising, and consumer engagement organization. With me today is Jason Dinger, who is the CIO, but in this instance, Chief Incubation Officer at Extension Health. Jason will tell us a little more about Extension, but for perspective, it's an organization that runs over 150 hospitals across the country. And to Jason's left is Wellesley Chapman, who is the medical director and responsible for innovation at Kaiser Permanente. The context there is that Kaiser is an integrated delivery system with, I think, probably over 9 million members. And Wellesley will tell us a little more about that. To start us off, I just want to put some context around the marketplace as we're all dealing with various components of it today, and then have Wellesley and Jason talk to us a little bit about their organizations, and then we'll drill down a little bit around the three main topics here of technology, innovation, and customer engagement. You know, if you look at the marketplace today, the insurer and the payer space, 5 publicly traded companies have over 40% market share. If you add the not-for-profit Blues and Kaisers of the world, then if you add the next 5, we're approaching 70% market share by 10 payer companies. On the health system side, 65% of community hospitals now belong to a health system or a mega system, and they employ 42% of physicians in the marketplace. Interesting statistic I saw recently, fewer than 50% of physicians now have ownership in a practice. Now, of those health systems, a little over 100 own their own health plan. So they are becoming more and more like the Kaisers of the world with an integrated approach to their market. Most of those tend to be regional players. If you move down the spectrum and look at the pharmaceutical business, under tremendous scrutiny right now, what is that, about a $450 billion conglomerate of drugs, and of that group, think about this, spends over $6 billion on direct-to-consumer advertising. Moving down the spectrum, you have the disintermediators that are out there that are getting a lot of press right now, the Walgreens, CVS. You add to that list what Walmart is looking at doing with Humana, and you look at what Uber and Lyft are doing in the healthcare space, particularly as they're approaching Medicare Advantage plans to be the medical transport partner, and Apple and the Amazonification that we've been hearing about. So you have these organizations that are putting a stake in the ground, challenging the Kaisers and the Extensions of the world in terms of taking a piece of the healthcare pie. And then the disruptor category. The statistic yesterday, I think, was in the last 5 years, $28 billion has been invested in digital health, telemedicine, virtual health, wherever we land with a name for it. I think last year was a record-breaking year in terms of about $6 billion spent in the Oscars of the world, the PillPacks, the Blink Healths, the Clover Healths, a whole range of organizations, which I'm sure we're going to hear a lot more about today in terms of disrupting the market, making a change, challenging a traditional player in today's market. So with that, I'd like Jason to talk to us about what Ascension is doing in terms of its positioning in innovation, how they even define innovation inside the organization, where telemedicine's role is and where that has played out, as well as other components of digital health and virtual health that they're exploring.
Great. Thanks so much. And thanks to the ATA for the invite to participate today. It's been a great conference and appreciate the invitation. Just for a little bit of context, Ascension is the largest not-for-profit health system in the country, a little over 150 hospitals. We've got thousands of physicians, ambulatory care environments, as well as senior living footprints in a little more than 22 states. And so we have really the privilege to see a lot of diversity of thought in innovation across the ecosystem. And I think, for us, it's been an interesting journey as we think about innovation because there's quite honestly so much going on. I think over the last decade, it's been fascinating to see kind of the number of startups and quite honestly the amount of dry capital that's being put against technology broadly used in the environment. And so for us, we start our innovation process really early in what kind of Clay Christensen would say in identifying jobs to be done, right? So these are things that providers or consumers or others would be struggling with in their environment. And they are typically mundane and not very exciting. I saw someone carrying a bag that was walking around that sort of said, "I love waiting rooms," said no one. Like that's a typical, sort of problem point where how can we solve for that? We know that people struggle with transportation. We know that people are actively looking for sort of solutions in home. And how can I care for my aging parent in their home, right? So our innovation process sort of cultivates sort of those jobs to be done and prioritize those. And we're typically solving against 20 to 30 of those at any one time. And then from there, we kind of look in broadly across the market to see kind of who's playing in that space. And at any one time, we'll have 10 to 15 minimally viable products that are being developed, and roughly 30% of those are organic solutions, roughly 50% are in partnership with startups, and another 20% are with corporate partners, somebody like a Lyft, who we have a national partnership with. And then we will test that MVP in 6 to 18 weeks. So we've taken an agile methodology and put it against kind of business modeling and business development, and then it flows through a stage gate process for us. So from testing to incubation to commercialization and then to growth. And I think the exciting piece for us has been that when we look at broadly across kind of the virtual care sector, that form factors and interfaces and the broad technologies are now getting diverse enough to apply to multiple different use cases, those jobs to be done. I think early on, there was a lot of question about, sort of what can we use this technology for? How can we be leveraging kind of virtual care broadly across the enterprise? Now we're much more focused on what's the job to be done and what's the most appropriate technology to sort of push against that particular use case. So that's who Ascension is. That's kind of broadly how we think about innovation, how we take new innovations to market, and how we partner with many folks like you in the room.
Great, thanks. Wellesley?
Yeah, thank you. So I'm really excited to be here. Thank you for the invitation. So I'm Wellesley Chapman. I'm a family physician by training, also a lean consultant, and for the last 5 years, I have had the opportunity to lead an innovation team as medical director of innovation at what was Group Health Cooperative, when we were purchased by Kaiser Permanente a year ago. Go KP.
And you get claps.
That's right.
I mean,
I brought a cheering.
whole fan club
Not
going.
a cheering.
Yeah. I got to work on my routine here.
So our role on our innovation team, and I'm really, so KP, large organization, integrated care and coverage across 9 states, I guess 8 plus the District of Columbia, and caring for around 12 million members across the country. My focus is really Washington, so Kaiser Permanente of Washington, and an innovation team there that has a really specific approach that's a little different than other regions. So I'm not speaking for the national outlook of KP or for other regions specifically. But in Washington, our job is to build startups. So we build startups within our company that either solve a very specific problem or try to get in the way of some usual ways of doing things. Both of those things are pretty difficult. You can imagine the latter is more challenging to our relationships within the organization. We have a portfolio that's pretty diverse. So we started out building retail clinics. Those retail clinics didn't feel very innovative to us because, put a clinic in the back of a drugstore, that felt like that had been done before. But that was what we were offered, that was, if we wanted funding, that's what we were going to do. So we learned a lot about design through that process. I came at it with a sort of a lean perspective and using 3P design methodologies, and we found that something was really missing. And that was really a deep understanding of what it was our customers were looking for, the problems they were trying to solve in their lives and in healthcare. And they told us that. So we found our way to design thinking, and that's really become a cornerstone of our process. So we build startups using design thinking and then a lean startup mashup kind of a process. And our job is to build a startup, and the portfolio is broad. It was retail clinics, and then a partnership with Zipnosis around e-visits. We did some process design around hip and knee replacements for bundled care, and then moved into complex care, really highly complex patients, a lot of social complexity, branched that off into a dementia product as well that we are launching more broadly now, and then coaching for primary care, which gave us an opportunity to work with Wellpepper as a telehealth platform. And then more recently, chat, and so partnering with SiriusMD around chat has been a real game changer for experience and learning for our patients. And then a rapid medication delivery product as well. So really all over the board, our focus is on being really true to this process, really true to design thinking, really focusing on the needs of our customers, and turning our sights now to designing 2 new clinics, 2 innovation clinics that are primary care orientation. I would say, really the thing that we are trying to do is we try to keep it simple. We're focused on the quadruple aim. And we're in a region that's growing. The problems that we're solving right now are, we are growing very quickly. And for those of you who know the Seattle region, the Seattle area, growing very quickly because of Amazon and others. So Seattle area is growing at 1,000 humans a week, and we don't have the housing to keep up with it. And it's a very expensive place to live. So we know that we can't hire into the growth that we are anticipating, the growth that we're experiencing. So we must find new ways to do this, and frequently technology is the way to do that. But we must have scalable processes, stable, reliable processes before we can bring technology into those things. So that's what we're working on now.
Great, thank you. So you can't go to one of these meetings these days and not talk about big data. So I'd be curious, not necessarily, although feel free to address it from the privacy issues, but what is the thinking and the strategy of using data and how you use it, whether it's data about the customer, whether it's claims data, to inform your innovation at the front end? And then how are you leveraging data at the back end and how are you integrating that in the care continuum and other aspects at the back end of a successful deployment of innovation?
I'll take that one first. So I keep asking my KP national colleagues where we keep the data scientists, because we don't have them in Washington, really. It has not been an approach. So we don't have a deep skill set. We have a research institute where there is some skill around using natural language processing to try to understand patients in a better way. In particular, we've aimed that at trying to understand misdiagnoses, in particular around neuropathy, and have demonstrated some ability there, but that's clearly just scratching the surface of what's possible. I think, as we think about the way we use data, we have typically used data by outsourcing services. For example, we use the ACGs out of Baltimore to identify and manage risk. And one of the things that we have found is that data is useful at gathering as a starting place, but that if I have a complex list of patients that's ACG qualified, about half of those patients will not be worth seeing because there's something that the team knows about them that is not encompassed in that claims data. So our view into claims really provides us a limited view. So enter Amazon, which to me was a car bomb going off outside of our headquarters. I think if anything good from a competitive standpoint comes out of that, it will be that we will follow in the slipstream there to really develop a better way of understanding patients as people, as humans, and all of their needs, and not just their medical data, but their behaviors, their proclivities, their preferences, and their social dynamics, and to be able to pull those into a format that allows us really to understand patient needs. But we're really pretty early in that journey.
Yeah, it's a great question. I think there's sort of three dimensions for us around data and deep learning. I think the first is a humbling experience, which is not all data is good data or helpful data, right? So I think we at least in the provider space, tend to overemphasize our data and its predictability because it's the data we use to make decisions. But as an example, we know that the number of TV dinners that you have in your freezer is highly predictive of what your cost and clinical outcomes are going to be. We know that the level of activation as measured by the patient activation measure is highly predictable of sort of what's going to happen in your future. We know that the activation level of your caregiver is equally material to sort of your future outcomes. And so I think the first dimension is what's really the data that we need and how we're going to go get that data, and we're going to have to think differently about both how we get it and how we store it and how we think about utilizing it for it to really have the promise that we want to sort of secure. I think the second dimension is the democratization of this data, right? So I think healthcare is relatively behind in being, we still in healthcare say they're our patients. Right, and I think how do we think about sharing data together between kind of consumer and institution? How do we democratize that in a certain way? I actually think while I think it's still looking for its killer app, I think blockchain technology is tiptoeing into sort of this interesting democratization of data, and I think its real promise to us is in building trust long term around data. And then I think the third dimension for us is really how do we do things in a way that solve real problems for people. And so the advent of sort of the chatbot and AI and a number of these things, I think they're still coming into view, but I think that is only possible if we can unleash our data, which is another just huge hurdle inside certainly I think the big institutions with their multiple table spaces and sort of infrastructure that kind of grew up geographically as opposed to part of an overall data architecture. So, is it the right data? How do we democratize that data and use data to build trust? And then how do we unlock that data for real deep learning that's going to add real value to a consumer? That's how we're thinking about it, I think.
Yeah, I think unlocking it and figuring out a sequenced approach to leveraging data is critical. I think one of the statistics that sticks in my mind always is of a survey of businesses, not just in health, but businesses in general. 80% of the data they have goes unused. So, and using it right is really the next step in that. Let me switch a little bit to of really why everybody's here, and that is customers. Some may call them users, patients, members, but we're all hopefully focused on the consumer in what we're doing. You walk through the exhibit hall full of robust examples of telemedicine and apps, all kinds of digital approaches to healthcare. Talk to us a little bit about what your experience has been and some of the tricks of the trade of how are you achieving the uptake after all this investment in rolling out technology to the marketplace that you're sponsoring, getting that in front of the customer, and then maintaining their interest and engagement over time, so it's not a flash in the pan. I mean, we've seen this in the wellness movement, 1.0, 2.0, 3.0. Yeah, 50% of employees sign up, and then after 6 months, 10% are left participating. This market is really not that different, and I'd be interested in what the thinking is and how your organizations are managing that customer part of the process.
Yeah, it's a great question, and I'm looking for a quality answer out there. I think so. I think the first step for us is we've got to make a real cultural transition, right? I mean, our industry was really built on the thought that if we build it, they will come, right? We're going to build a fixed asset, and we're going to have everybody in a certain radius come to use our facility, our physicians. Our whole culture is built around expertise and people coming to that expertise, and so we need to really own up to the fact that our industry has been really about us and the importance of us, and you should be grateful for everything that we're doing for you as a consumer. That culture has to change in broad and meaningful ways. I think that's actually the first step. I think the second is we have to really spend more and more time understanding you, the consumer, what and how you make decisions. Healthcare, it's interesting to me that healthcare is also one of these places where people behave a lot different than what they say. So you'll do a focus group, and they'll tell you something, and they'll behave entirely differently. And so I think we have to overinvest in really understanding what's driving people's behavior. I'll give you a mundane example, right? So one of the things we're working on is annual wellness visits, right? So in our country, 20% of people, even though it's now free for covered people, get an annual wellness visit. It's in your best interest, right? Because we're making sure that there's nothing wrong. It's like a checkup. But almost no uptake, right? When we engage people, I want to be able to do my annual wellness visit in 20 minutes, right? And if it's going to be longer than 20 minutes, I'm not interested. I'm gonna opt out of that because it's not really creating value, because you as a system, you only create value to me when I'm sick, right? I don't really understand how you create value to me when I'm not sick, because you don't do that. And then you start to watch how they behave. Turns out one of the biggest indicators on them assessing whether or not it's going to take 20 minutes is if you require me to park in a parking garage. And if you tell me I got to park in a parking garage, all bets are off on how long. I got to figure out, like, I got to navigate the parking garage. I got to figure out how to make it out of the parking garage. I got to find where the office is, right? These are kind of nuances, but they are absolutely material to how people make decisions. And I think that is important because we, I think, are still struggling as an industry to talk about the value proposition. We tend to talk about the value proposition as a function of the asset, right? And we need to be sort of saying, here's what we're going to solve for you, right? And oh, by the way, we're going to do it in this way. Right, so we're doing some really exciting work in Austin with Christy Henderson and her group around this notion of, I want to call you and then I want you to tell me, I want you to triage what I need, right? So if it's something really clear and clean, I want you to recommend a virtual care visit for me. If it's something I need a face-to-face for, I want you to refer that. But I want to tell you how close they are to me and how long it's going to take me to get there, right? And so I think we have to better understand what's really the job to be done and how we want to engage it. And I think the other piece, I'll end here on this slight soapbox/rant, that we need to solve things. Right, it's fascinating, right? I'll sit in these meetings and it'll be like, we need better navigation. Like what industry is sort of like focused on navigation, right? We'll make it easier for you to go find something, right? They want us to just straight up solve it, right? They want a solution, right? We're working on a piece of clinical trials, right? The consumer is sort of like, I'm having trouble accessing clinical trials. Well, in reality, what they want us to do is they want us to proactively reach out to them when they qualify for one. Not have them sort of like fill out a bunch of information and then go meet with 3 different doctors and then fly somewhere else and go find a PI for the, right? That's a mess. And so I think the last piece is, do we understand these jobs to be done enough to actually complete real solutions for people and sell that as a value proposition with technology being a part of it, but not an end in of itself. All
right.
Sorry.
So just to reorient around the question, we're talking about the consumer
Right.
aspect of...
And getting them to accept the kinds of things that you're rolling out,
Yeah.
and then keeping them engaged.
Yeah.
You could add on to that, what about the customer, so I'll add a third one on for you. What about the customer who's just never going to engage in technology? We can't forget about them.
Yeah, yeah. Well, I think that population is getting smaller and smaller, so that's helpful. So I think the first thing we have to do is we have to really orient around solving a customer problem. I think we've spent a lot of time in healthcare solving our own problems, or solving regulatory problems, or solving Medicare problems. Those problems get put before us, and then those things take the place of real consumer problems. And so understanding the consumer problem to be solved and solving it is the important thing to do. Now, but we also have to really get the right customer in touch with the solution. It has to really solve their problem. In my team, it really has to surprise and delight them in a meaningful way. And then it has to be sustainable for them over time. So a few examples, and this is where my team really gets into the weeds with this stuff. So we design and build, and then we operate, and then we hand off solutions only after we have operated them and run them through several different functional iterations. So a year and a half ago, we were running a coaching program for high-risk patients and felt like coaches use software. The coaches said, hey, we're used to using software. So we said, we're going to build you some software. So we built them some software. We had some great ideas around it. But what we hadn't figured, there were two real flaws with it that we learned a lot from. One is we really didn't have a stable intervention. We didn't have a stable platform on which to then scale it with software. And so the variation in the process just got worse. And very quickly it got worse. The second thing is, this was not the right population for coaching. Really, we had experienced some successes, but that a stable sort of coaching intervention requires people who have some agency in their life, some ability to change and to take control, and then they can use the software, and we didn't have that population in front of us. So over time, we found the right population for coaching. We really nailed down the process. We've seen some really good results over time in how we're able to help, for example, patients with diabetes to improve their blood sugars significantly, sort of across all metrics, blood sugars, blood pressures, their weights, their depression scores, and that those are sustainable. And now you have a process onto which you can start to put a technology and say, this is something that does for us the things that we need technology to do. So we need it to be asynchronous, to remove some tasks that were synchronous tasks so that we can think about doing them in different ways at different times. And then to task shift, take things that were manual that we were doing and shift those to the patient or automate them completely. So we're actually just launching then another test, and we feel like we're in a much better place with that. The second is, so for example, our chat service. So we had work that we did for a few years around e-visits, and I thought e-visits were the coolest thing in the world because they solved my problem from a lean consultant perspective and from a care delivery perspective. It really crushed lead times down significantly, and the software was great. It was engaging and interactive, and it was responsive, and if you have a cough, it'll ask you cough questions, and if you don't, it doesn't bother you with them. And I thought, patients are going to love this, and we really struggled to get them to use it. And I thought, what is it that they know that I don't seem to know? Or maybe they just don't know what I know about it, and they'll all come flocking, and it took a long time, and they just haven't, and they still haven't. Enter chat, in which the experiment there, and this is the surprise and delight piece, is that what we do with chat is we remove every administrative or triage barrier between a patient, what we call a member, and the solution that they're seeking, the human solution they're seeking. Now, some members refuse to believe that that's actually a doctor on the other end, and they say, you're a robot, and then they'll enter into discussion about who's a robot. But we remove every barrier, and it is so surprising to people to be given this sort of fresh text field with no instruction and no limitation that allows them to enter a question. And some people enter with hello, and some people write, I fell shoveling snow 2 weeks ago and I can't move my left arm. And they get an immediate response. And so this is then, I think, the last really core element to us is they get an immediate response, and that response is very clearly human. That response is very clearly empathetic. And so we have designed a process, and we train to it, we recruit for it, and we manage to it, that the human interaction is everything that a patient is looking for in this super thin medium of chat, where you don't have many opportunities, many lines of text to form a relationship, but that we are going to do that. We're going to form a relationship, and we're going to have people at the end of this saying, this was so great and really surprising to them. We've needed to do zero marketing, and we are well along our journey to being where we want to be in terms of volumes. It's just a very different sort of thing. And so for us, that experiment is really hitting on all cylinders and across all those dimensions.
Yeah, I mean, two things I'd add on to that. We did some research with individuals that had at least one chronic condition. And what came back is about 55% didn't feel they needed to do anything special about their health care, that they were just fine. What we found as we dug in is the industry does a very good job of providing a lot of information about their diabetes or about their asthma or about a kidney issue. tons of information, but none of it is connecting. What's missing is making, and you alluded to it when you said you're establishing a relationship, making an emotional connection with the individual. And that takes data and personalization, but understanding that it's not just about quitting smoking and your health will be better. Maybe the emotional connection to one individual is that they're going to look better physically. Another individual is they're going to have more years to spend with their family. But that emotional connection versus dumping tons of educational information on a customer tends to be a big factor in it. And the second thing I would say that we've seen in a lot of clients is the ability of the care management area, the medical director to connect with the marketing area, who understands much more messaging, segmentation with patients and with members. So if you look at it, this CMO squared, Chief Medical Director, Chief Marketing Officer, collaborating about what goes out to a customer. And we've started to see a lot more uptake and a lot more engagement when those two siloed parts of most organizations start working together. So, you know, I think you're whether we're in a for-profit or a not-for-profit setting, someone in this C-suite is asking about ROI. And you know, a lot of organizations have put incubators in place or have put innovation functions together. Where are those discussions headed, and how much pressure is there to go back and say, all right, where's our return on this investment?
So it's interesting. Our model at KP is we book our revenue as a health plan, and then I feel like we really earn it in care delivery. But our revenue is really fixed at the beginning of a year, so we know what we have to spend, and so ROI. Strangely, often goes through this process of, well, how many more visits are you going to be able to deliver as a result of this, or drive to quality, and that seems like a really strong return as well. The way that we've started to take ROI recently is, well, we have these problems around growth where we know that there are not enough physicians, certainly not enough primary care physicians for us to be able to hire into the growth that we're experiencing and driving toward. And we know that people can't afford to come live in Seattle. So a lot of our staff can't live close to work, and we have a core of services in an expensive region. So those are problems for us to solve too, and they become part of the ROI experience for us. It is tough to kind of hit the finance department with some of those, but we have a really forward-thinking chief financial officer in our region, Karen Shartman, who is helpful in that way. The other thing around care delivery is the burnout and the cost of burnout among our teams. Those teams are not delivering the kind of experience that we want. They're not able to achieve the kind of quality that we want. And then there's a lot of turnover. And if you take recruiting seriously and you are experiencing a lot of turnover, that's what you spend your time doing, and then not solving the problems of your customers or your teams. And not really managing in the way that you could. We can peg churn of a physician to about $250,000, so that's a pretty quick ROI if you're talking about creating an environment in which physicians are willing to stay. I think a place like KP is a place where we hire people and say, hey, look, we expect that you're going to be here for your career. We want to make it be that way. And when we start to experience it not being that way, well, we didn't really have a strategy around changing that because we were really being driven by the market and the behaviors of the market more than really taking control of it. So I guess that's a long-winded way. There's a standard sort of ROI equation, and I don't think it applies in the same way anymore because we need to solve different problems. And I don't know if anybody's noticed, but the experience that patients have in healthcare is like not the best. So we're really driving to a better experience too, and being able to measure that, deliver that, and say that is an ROI calculation that we have to take into account, because it's the only way that we're going to actually maintain patients and grow, is to be able to deliver that product or service to them across their experience. Both their care experience and their financial experience, their health plan experience, has got to be one that has them say, I'm not going anywhere. Every year I get an opportunity to choose someone else, and I don't, because this is great. So figuring out, I have a very smart business partner, Elizabeth Fleming, who is better able to explain those things than I am, and to be a whisperer to the finance department. But that's sort of where we are with ROI, thinking more broadly about it.
I think there's two aspects for us. I think one of the things that I really feel grateful in being a part of the Ascension family is that we're a nonprofit, and so the dimensions by which we measure ROI are really diverse and broad. So certainly we're looking for sustainability, but thinking about how we care for poor and vulnerable populations is really material to us, and how we reach out to kind of forgotten communities, as well as thinking about how to disrupt in the quality of care arenas. All those things are important. We could talk about that. I think for us on the innovation side, what's been very helpful for us is to create this stage gate model to take the pressure off of any single idea. So there's a lot in behavioral economics that shows that you get into real problems when you've got a few eggs in your basket and you're making kind of some big bets. And I think what we've learned from, quite honestly, the technology sector is, you should have a portfolio of 10 to 15 different things that you're constantly testing against, and then a few of those go on, and then they get a little bit more money, and a few of those go on, and really educate you about a market that may open up an acquisition or another sort of growth play. And so the real changes we've made have been on developing that stage gate model and testing these things really quickly and often, which then puts the premium on learning and takes the pressure off of a distinct ROI.
So taking it back up to the 50,000-foot view, as your organizations and inside the boardroom are seeing things like the CVS Aetna deal and the Walmart Humana and Cigna and Express Scripts, some of these mega deals coming together, and then you're seeing Walgreens partnering with LabCorp and Quest, and just announced another Blue Cross plan. They're really moving through partnerships rather than acquisition. Is that influencing the strategic direction around innovation and technology inside your organization, and how do you think longer term that's going to impact you?
So let me kind of separate that into two different questions. I think by and large, there's going to be, I think, more and more consolidation, partnering, acquisition in the healthcare space as people look to kind of defend their territory, right? So, if I'm a retail, chain, how's the PBM going to disrupt me? How's Amazon going to disrupt sort of at-home delivery? So I feel like the large public markets, it's always important to see what they're doing, try to understand what's at play. But I think that in many cases that's they're defending territory. So and because of that, we don't focus a lot on it. Mm-hmm. I think in terms of innovation, I think we believe that the next frontiers are still open to us. And what I mean by that is there are so many ways in which to make healthcare better. I'll just highlight one. We've really moved much more to an experience economy, right? People are looking to, acquire an experience. If you just look at, sort of folks like Airbnb and the rise of that sort of experience platform to, folks in, sort of the bundling of services for turnkey. Who would have thought the boutique hotel would have come back, 10 years ago? So I think where we're primarily focused is how can we make that experience sort of best in class for people and abstract complexity out of a very sort of complex-ridden world. And I think the folks who do that are gonna win. And I think that the reason for that is, when you look at high deductibles and, everything is really becoming consumerized in the space. And so trying to consolidate kind of this business to business environment, I think is going to be helpful in the short run. I think it's more problematic in the long run. And I think that's actually why people are most concerned about the Amazons of the world, because they see that trend coming and they're not built for it.
Yeah, so maybe it's sort of a naivete on my part, but I look at a lot of the consolidation and it doesn't bother me from my perspective where I sit within Kaiser Permanente, because I feel like a lot of that consolidation is, I like the way you describe it as sort of defending a territory, that none of that really erodes what I believe is our competitive advantage. Now, do we take full advantage of our competitive advantage and live into it? No, not always, but that's still available to us, that the space that we can occupy in the market that no one else is fully able to occupy is still there. Meaning we can integrate care and coverage, and within the care, we can fully integrate primary care and specialty and run all the way up and down that chain and do it in ways that others would really struggle to do. So can I, in the middle of a primary care visit, bring a specialist in and not worry about the revenue model around it? Can I solve a whole lot of your problems through a telemedicine function and not worry how we get paid for it, right? It's just a very different kind of place. But now enter Amazon, and this is why it felt like a car bomb going off. And I looked around, and I think a lot of people around me were saying, "Did you hear something? I didn't hear anything." And because I don't know why that's not more worrisome to people, but I think they're going to try some really interesting things in the market that do significantly erode the competitive advantage that I feel like Kaiser Permanente enjoys. So that space just got smaller for me, the things that we can do that others will struggle to do. And it really is around that integrating the primary care and specialty. That would be a heavy lift for them to really start to move into specialty. And I don't know what they're going to do. Marty Levine, who they hired recently to run their medical group, hired me to work at my first job out of residency. And he won't tell me anything about what's happening, so I remain in the dark.
But has he called you for a job?
No, I'm a little hurt. He has come after my colleagues, but I think you would hire somebody like him if you were going to do a really engaging, high-quality, face-to-face care, and then also be able to bring in the data around it. But there is still a kind of competitive advantage that is smaller but remains, and so it will be interesting to see either how naive I am or how much that continues to erode over the next 5 years.
So I have two questions left. One is a prediction and the other is advice. So the first one is, you both have seen over the last 3-5 years where telehealth, telemedicine has come. There was discussion yesterday that this really should be called the virtual health meeting. As a matter of fact, to verify that, On my way here today, I was texting with my millennial saying I was going to a telemedicine meeting, and the question came back, oh, do you mean virtual? So where do you see this industry segment headed? What's going to change? What's going to get better? What needs to be done away with?
Yeah, I think I'm going to just really simplify my answer to that. I think that when we are the best at using tools in the healthcare culture, it is that we don't silo them. We don't silo that service, say that chat service. There's a real tendency for us to think, well, it looks like a call center, right? That function, so we're going to build it like a call center. And now I think we've done a real disservice to our company and to our customers because we don't see how that really integrates. That's just a tool, and it can be used across all of our systems. So I think when we're at our best in using, so in KP Washington we call it telehealth. When we are best at integrating telehealth, it is that the tool really builds on an interactive, relationship-driven process and makes it better, makes it more human, makes it more efficient, makes it more affordable for our customers without sacrificing any quality or safety, and even enhances those things. So not to build those in siloed ways. I don't know where we're going to go as an industry with this, but I've become more and more dedicated and focused on making sure that we are not building any silos, that these things are really fully integrated from the start.
I think that's spot on. I think in terms of moving forward, I think the technology is going to get smarter about how to leverage itself. So things that our team is sort of fascinated with right now is like gaming, right? And this, I have a 13-year-old who is like deep into Fortnite right now. Like, we can sort of lament to it as parents, but like I'm also like equally fascinated, like what's going on here? And then you get like things like Twitch and this notion of like watching other people do things and what does that look like? And I think just to my point, he would never kind of orient to that as a technology. Right, this is a way for me to sort of like interact and communicate, and it's how we have fun, and so it's sort of just an example layering onto your point, which is we will increasingly see technology as this key enabler, but it won't be our calling card. And I think folks that can embrace that are really going to see kind of huge growth. I mean, where I read this morning, 238 million in 1 month off of like a Fortnite game that, I mean, it's really fascinating. And I think what we've learned is that technology that works for everybody. It just takes a little bit longer for certain people to adopt it, but it's not restricted to a certain kind of demographic. So that
yeah, excellent. Thank you. So now the advice. Some people here have an innovation lab inside their corporate structure. Others may mentor at a local accelerator or an incubator with Startup Health or Rock Health or Matter here in Chicago. As everyone in here is juggling the subject of technology, innovation, and engagement, what are 2 or 3 takeaways that you could leave us with in terms of some of the biggest challenges and how you've overcome them, a couple of potholes you may have stepped in and how to avoid them next time around, just 2 or 3 nuggets about how to be successful with this.
I think that you know, I mean, potholes, usually I'm dealing with like extracting large vehicles out of ditches.
Sinkholes.
You know, you know, the comment I would make is is spend as much time with your end user as humanly possible. It is amazing to me how little time we spend there. I mean, you know, for me, just on a personal basis, you know, I'll have meetings but if I have any downtime, like I'm in a waiting room, I'm in a cafeteria, and I'm asking questions like, what is their experience? What does this look like? How can we do better? And I would say almost all of our best feedback is from that population. And I think we can get really excited about technology and really quickly become sort of a hammer looking for a nail. And nothing replaces sort of that face-to-face interaction with people and observing kind of sort of what they do. I think the other is I would try as best you can to create a premium around learning. And I think innovation in general has historically focused on developing the next thing as opposed to informing about what we're learning about our products and services. And I think if you can build kind of your innovation talent around learning and translating that learning into how to make products and services better, you'll achieve a lot more success quickly, because things always behave differently in the wild, and you're going to have to iterate tremendously, and that iteration cycle only gets smaller when you understand who you're dealing with. So those have been our two big learnings.
Mm-hmm. Great.
I like your advice. I'll follow your advice. So I think I would echo that and then add that that I think we really need to be thinking about in terms of healthcare, that the tools that we're building, and I'm going to sound like a broken record here, are really enhancing relationship. Example, my team spent about 30 hours, no, nearly 60 hours recently doing ethnographic research focused on a couple of different populations, but a little over half of it on the Amazon population, trying to understand this growing demographic in Seattle. And I thought I knew what they were going to say about their healthcare desires. I thought that they were going to see healthcare the way they see the food truck, and that this was really going to be highly transactional. But it was really important to them that there be relationship in this, and that they are happy to have transaction across many dimensions of their life, services, experiences, products. Healthcare is not one of them. They really take this seriously, and that they needed relationship. And that was a big learning moment for me, because I thought I was prepared to go build something for them that was really transactional and super efficient. And they proved me wrong. So you know, everything we are building right now is there to enhance a human connection, or make one possible where maybe there wasn't before. So I think that's really the main focus. And then I would echo what you said about learning, is that we almost never get it right the first time. And when we enter joyfully into an experiment of putting an MVP in front of a customer and say, in 6 months, we will be proud if we are embarrassed by that first product that we put in front of them, then that's a success. And that's not easy for an industry of perfectionists to wrap their arms around, but to go in with humility that the solution that you've got right now is the worst possible solution that you can put in front of them.
Well, listen, if I occupied the questions, I apologize to the audience. Plus, I think I forgot the iPad that the audience questions come in on. But we've taken a full hour of your time. Please join me in thanking these two guys. I think that it's been a great education. And on to your next session. Thank you.